Hi, welcome back to Med and Me. Today we're joined by Miss Faye, who is a physician's assistant. So what is your education type? What kind of education did you need to become a physician's assistant?
Hello, and thank you for having me today. So, a physician assistant is a 2.5 year program after undergraduate degree. So, you have to have a bachelor's of science, and then it is a 2.5 year master's degree and certification program.
Okay, is there a specific specialty you work in?
No, physician assistants often say the school is like a mini med school. So you have to perform every rotation just like medical school, except we don't go to school and learn as much in detail as if you went to medical school. So you have to do a rotation in, for instance, um, oncology, hematology, pulmonology, cardiology, BGYN, neurology, etc.
Okay. So what was your motivation to become a physician's assistant?
I wanted to become a physician assistant because I wanted to learn more about disease processes and how to diagnose and to treat. And I wanted to prescribe medications and further my education and help people live healthier lives.
Okay. So could you possibly walk us through a typical day of being a physician's assistant?
Sure. And currently, physician assistants go by either PA, and the name has also been on a changing trend to physician associate because
Mhm.
the title physician assistant implies that you're helping the doctor, but you see a patient just like the doctor would. Okay, so a typical day. So if you worked outpatient, then you would schedule your patients just like a doctor would every 15 to 20 minutes. And you would have your patient load, patient schedule, so the patient would come see you and explain their symptoms, and you would perform a physical exam. You would order any testing, which includes blood work, radiology, or any other tests if needed, and then formulate a diagnosis and then form a treatment plan, which can include prescribing medications or physical therapy or dietary needs.
Okay, that sounds really interesting. So, what would you say are some pros of being a PA?
Pros are you get autonomy and you're able to diagnose on your own, and you have prescriptive authority, and you get to suture, which I really love suturing, and you really get the reward of having people know that you did your best to try to help them and to help them feel better in their family life. And also, it's a good salary, and you get to choose where you want to work. So you don't specialize, but you choose in what area of medicine you want to practice.
Hmm. Would you say there's any cons of being a PA?
Cons, just like a lot of healthcare professionals in the medical field, time constraints is the biggest con because sometimes it's hard to give the patient as much time as they need, yet still be able to bill insurance companies and raise enough revenue for the practice. So you don't get as much time with a patient as much as you would like. Another con is malpractice. So you have to have malpractice insurance and pay for that. And another con is that often, some PAs take call, which means they can call you at night or on the weekends. but often too, you usually just think about your patients all the time because it's important to you. And even when you're not at work, you think about them. So it's kind of hard to turn your work brain off.
Hmm. So, would you say there was a certain experience that stuck out with you um throughout your career?
Yeah, several experiences. One is I I enjoyed working in plastic surgery and helping women with breast cancer and providing reconstructive services, which includes, I know it sounds odd, but includes nipple tattooing. So a lot of mastectomies involve removal of the nipple. And it sounds like it wouldn't be in the realm of being a PA, but it actually makes women feel really better about themselves and more normal after having a surgery. And other memorable, just certain cases when I used to work in the emergency department of diagnosing appendicitis even before you got the CAT scan results back. Knowing kind of that you had an indication and a hunch of a diagnosis and you were correct. And then you also have small rewarding moments, such as like when I worked in gastroenterology, I remember helping this elderly lady, and we were going over her medication list, and she pulled up this ripped up piece of paper, and she could barely read it. It was illegible, and that was her medication list. So I stopped what I was doing and said, "I'll be right back." And I went to my computer and typed up a big medication list in big font so she could read it. And she was so happy she cried because somebody just did something a little for her. So that was rewarding. And also your coworkers are very important to you in the medical field, so they never leave your mind.
Hmm. That sounds like pretty interesting and exciting to do. So, what kind of person would you recommend being a PA for?
Do you mean for somebody who's interested in the career?
Yeah, like what kind of qualities do you think they should have?
um Drive to learn, just like you already have. And also humility to being able to recognize when to ask for help or when you need to ask for second opinions. And also someone who has people's best interest at heart at all time, even when you're tired and it's the end of your shift.
Mhm. So, do you have any tips for high schoolers in particular if they want to become a PA?
Yes. So I would look up the schools that offer physician assistant programs. Look at their prerequisites because some of the schools have different prerequisites. Make sure to take those in college and make sure to shadow a PA and also get any healthcare experience, which includes anything from front desk help or answering phones, because that is just as important as what a physician does or a PA does. So being a team player.
Hmm. That's really great. So, that's all the questions we have for you today. Thank you so much for coming on the podcast, Ms. Faye, and helping other students learn more about being a PA.
Well, thank you. And thank you for asking me. I appreciate it.
Thank you so much.